A picture is worth 1,000 words, but a video is worth 1,000,000. What is 4D demonstrative evidence? This is a powerful tool for settling cases. Attorneys have called what we do game changer, worth its weight in gold, and other names that they told us they cannot put on any review because it would be a conflict of interest when they wanted to use us again. MedLaw4D. Basically, if you have the truth on your side, you can show it, and in a way that is tangible to the average lay 4th grade educated jury member. As you know, the way things work currently in a trial is that the jury is listening to an expert and saying to themselves, "Oh, that expert is talking authoritatively, so they must be right." Or, "He's wearing a suit, so he's probably professional and therefore correct." Or, "She's wearing glasses, so she must be a nerd and therefore knows what she's talking about." Obviously, these are all arbitrary factors. However, 4D demonstrative evidence takes the battle away from the experts by making the pathology tangible to the jury in a way that they can understand the truth. We now live in a day and age of video. Whether it is Facebook, YouTube, etc., people relate to video. It tells a story, as opposed to your typical Exhibit A in trials of the past, which is just a single snapshot in time, often a single cross-sectional image blown up with an arrow pointing to something that even doctors who are not radiologists don't understand or know what they're looking at. MedLaw4D makes 4D demonstrative evidence, 3-dimensional videos with the 4th dimension being time. Essentially, a radiology 101 session, if you will, that keeps the jury's attention, garners credibility, and is very visually interesting. Normally, the jury has what we call a U-shaped curve for attention, where they're only paying attention for the first 5 minutes and the last 5 minutes of the presentation and are basically snoozing for everything in the middle. However, with 4D demonstrative evidence, they are nodding and understanding the whole time. These are not animations or artist drawings, but rather, they're actually processed from the initial data, the raw data of the radiology examination itself. And therefore, it's always admissible. We have a 100% admissibility history with all of our exhibits. We can use the CT, the MRI, the X-ray, the mammogram, the ultrasound, you name it. And how can this not be admitted? There are actually billing codes for 3D post-processing. Doctors can order 3D tests for diagnostic purposes. Radiologists regularly post-process the raw data in 3D as part of their interpretation. The technology is not new, but it's the application of this technique for medical legal work and the artistry of how we do it at MedLaw4D that's new. Creating good exhibits that people can understand is an art. For example, everyone can take photos on their iPhone. However, it's only great producers like Steven Spielberg who know what angles to show. Similarly, not any radiologist can produce a demonstrative evidence that's effective, and every case is different, so really this requires artistry and years of practice. We've been doing this now for almost a decade, and we aren't even proud enough to show you our work from just say 3 years ago because our techniques are constantly improving and the level we're at today is unparalleled. You have to be facile with a professional quality video program and then use radiology media, since there's no radiology video program specifically out there. And then you have to like to talk about it and narrate. So this is a sub niche for us. We fly all over the country presenting our exhibits and trials, but we also can do these presentations remotely on TeamViewer. And judges have accepted this, which saves the firms and insurance companies a lot of money. Also, some other demonstrative evidence companies, such as our competitors, are trying to be in this market, but those companies are run by grad students who are a PhD making these videos, not radiologists. I've personally been in depositions where the opposing counsel used a demonstrative evidence video, and let me just say, it was a beautiful example of something that was 100% wrong. This work must be done by a radiologist, and one who specializes in this area, and one who has taken years to practice and hone this art, and this is what we do at MedLaw4D. 4D demonstrative evidence are trial exhibits, but ones that don't usually make it a trial, because once it's released, the other side gets scared, thinking, "What will the jury think?" And then they'll want to settle. You can use it in mediation, arbitration, and of course depositions and trials. Furthermore, you can save money because you don't even need to hire a radiologist to run the PACS system. You can just remember, okay, I need to fast forward and stop at 1 minute and 23 seconds, and then I need to stop again at 3 minutes and 9 seconds. 4D demonstrative evidence isn't just used by radiology experts. Rather, the exhibits can be used for any type of expert in any field of medicine to demonstrate their case merit. Again, all that matters is that you have the truth on your side to be able to show it. You can even take the current additional imaging of the contralateral side, for example, the abnormal right shoulder of the patient against the normal left shoulder, just to show the normal versus abnormal in the same patient using our protocols that will create a beautiful image. And this avoids objections from the opposing counsel to using normals from the other patients with different proportions. So how much does all this cost, you may ask? Well, a typical video can take anywhere from 1 hour to 4 hours for the longest video at our hourly rates. So basically, for $2,000 or less, you can have an exhibit that will help you to settle a case right from the onset, save you tens to hundreds of thousands of dollars, plus save you lots of time and effort, all simply by demonstrating the truth about a case in a game-changer kind of way. Call us now to get your free 20-minute screen share session to see this powerful tool in action, MedLaw4D.